Welcome everyone! Today we are going to discuss the emerging roles of ivermectin in skincare, specifically for conditions like rosacea, acne, and skin cancer. Ivermectin, a broad-spectrum anti-parasitic agent, is making waves in the dermatologic world. Originally FDA approved for parasitic infections, its topical formulations are now approved for dermatological conditions such as rosacea. So what's driving this shift? Ivermectin's primary mechanism involves anti-inflammatory, anti-parasitic, and immunomodulatory actions. It inhibits pro-inflammatory cytokines, reducing skin irritation and erythema. This involves blocking the release of TNF-A and IL-1B, key players in inflammation. By dialing down these cytokines, ivermectin effectively eases inflammation. In rosacea, Demodex mites play a significant role. These mites trigger immune responses that cause redness and pustules. Ivermectin targets these mites, reducing their population and thus the associated inflammation. Clinical trials show that a 1% ivermectin cream can significantly reduce rosacea symptoms, earning it FDA approval. Now let's talk about acne. Although off-label, ivermectin's anti-inflammatory effects show promise here too. Acne vulgaris involves inflammation, sebum overproduction, and bacterial colonization. Ivermectin helps reduce inflammatory lesions, particularly in patients with Demodex infestation. Its inhibition of TNF-A and IL-1B supports its potential in acne treatment. Turning to skin cancer, ivermectin's role is still experimental but intriguing. In non-melanoma skin cancers like BCC and SCC, ivermectin shows potential by modulating key signaling pathways. Studies indicate it inhibits the AKT-mTOR pathway, crucial for cell growth and survival. This inhibition can reduce tumor growth and increase apoptosis, or programmed cell death. In vitro studies show ivermectin can induce autophagy and apoptosis in BCC cells. A 2016 study highlighted this in Cell Death and Disease, noting ivermectin's ability to inhibit BCC cell proliferation by inducing autophagy. This process helps degrade and remove damaged components, which can suppress cancer cell growth. While still experimental, pilot studies are promising. More clinical trials are needed to confirm its efficacy and safety in skin cancer treatment. In summary, ivermectin cream and paste are proving effective for rosacea, with growing evidence for acne and skin cancer. Its mechanisms are well supported by research, but more studies are required, especially for off-label uses. As more clinical studies are conducted, ivermectin's potential in dermatology continues to expand. This video is for educational purposes only and does not constitute a medical advice. Thank you for tuning in. Stay updated, subscribe to our channel and learn. Until next time.